Hey, hello, medical assistant students. This video is to help you uh, find the information that you would need to complete the medication classification assignments. So, in your rubric, there are several different options of resources that you can use to locate the information that you need. And the information that you're going to need, a couple pieces have been given to you, but you need the medication classification title, which you don't have to search for that because that's already given to you in the assignment instructions on that table. Just take that and then pop it into, again, either the one of eight questions or into the concept map. The next piece of information is going to be the brand name and the generic name of the medications. Now, on your list of medications, I've given you the medications that you're going to use. Most of them, there's going to be three medications under that medication classification. Sometimes there's honestly only one, and sometimes there's going to be only two. As long as you give me both the generic name and the brand name of the medications of the list that I provide you, then you're good to go. You don't have to add any more if I don't give you three of them on there. There'll never be more than three. It's only going to be three. Again, if I give you two, then you only need to list two. But just make sure that you provide both the generic and the trade name for as many as I list. And then you need to find the indications for use. So again, what it's going to be used for, the desired effects. What do you expect that drug to do in the body? And then you have to do side effects. You have to list three side effects. And then you have to list two adverse reactions. And when I go over these websites, I'll talk with you about the difference between a side effect and an adverse reaction and how to identify which one is which. And then you need two pieces of patient education, which we already talked about where to find the patient education. But remember, not everything's in your book, but look in those before you go anyplace else. If you want to look in those green boxes in your textbook to find the patient education, because it's perfect right there. And then you're just going to list where you found the information. So taking that being said, I want to show you two different websites where you can find the information. And these websites are listed in that bullet point in your instructions of examples. I'm just going to do these two examples. You can research other websites if you want to. Again, as long as they're credible. Wikipedia is not credible. Do not find information from Wikipedia because it's not credible. So the first website that we have is the PDR.net. This is a very credible source. You open up the website here and oh, sorry guys, I'm tired. The best thing to do is for the medication classification, take one of the medications, not the medication classification in itself. You're going to actually look for the medication. So under penicillin antibiotics, one of the medications on there is actually penicillin. So if you type in here the drug and you search for it, it's going to give you several options, or it's going to give you whatever options that they have. This is where you can actually see the brand name and the generic name. The brand name is going to be this top one right here, where it says Bacillin CR or Bacillin LA or Penicillin G potassium. Sometimes the brand name and the generic name are going to be the same, and that's okay if you can't find another brand name for that generic name. You'd put the same. Most of the time, you're going to have a brand name though somewhere. So make sure you look. So kind of like this, penicillin G potassium has Pfizer pen as its brand name. So anyway, I'm going to click on this one. You can click on any of them. You can go to drug summary, full prescribing information. So you're going to click on this. In this area, this is where you're going to find the different categories. So classes, you can see that it's under a penicillinase sensitive penicillin antibiotics. Okay, so we're good. We know that that's in our category. It's under the penicillin antibiotics. You don't have to worry about administration because I don't need to know the administration, anything about that for this, because we're just going to focus on those areas. However, right here, there's your adverse reactions. If you go down, there is another area that talks about side effects, and we'll go over that in a minute, but adverse reactions. Here we have some severe adverse reactions. This is where, when you're talking about an adverse reaction versus a side effect, adverse reactions are the ones that are severe. These are the ones that can be life-threatening. These are the ones that you're going to want to stop taking the medication now because it could cause death, or it could cause severe issues if you continue taking the medication. On this website, this is where you're going to find those severe adverse reactions, such as serum sickness, azotemia. You can see angioedema, seizures. These are severe. If you get a seizure, you're going to want to stop taking it. To find an actual side effect, you can see mild adverse reaction. This is where the side effects, and side effects very well could be just those mild irritations that the doctor may say, I want you to continue taking the medication for the duration, and we'll just deal with, like, let's say if you have diarrhea. The diarrhea should go away in 2 to 3 days, or this is the best medication for you. Let's give you something to control the diarrhea, as long as it doesn't turn into dehydration. You let the doctor make that determination, but you're looking at something mild that the doctor may say stop it, or the doctor may say, no, let's just continue the medication. So that's how you identify the difference between an adverse reaction and side effects. So side effects, you need 3. I'm going to look at mild right here, and there's another area, like I said, another area in here you can find side effects, but I'm going to look at 3. I'm going to say, okay, diarrhea is one of them. Cool, I'm going to put that down. The pruritus, which is itching, you could write that down. And the other thing, myalgia. And then for your adverse reactions, go up to the severe and then write down 2. Oh my gosh. Sorry about that. So there's your adverse reactions. Common brand names. We already talked about the brand name on the other page, but this is where you're going to find your brand name for that as well, clicking on here. I don't need to know the DEA class. That doesn't matter to me. However, the description, this here is going to show you a little bit about what primary agent for Streptococcus pyogenes. So there is some usages right here as well that you could use for the descriptions. For the most part, though, you're going to, under the dosage and the indications, because that's what you are looking for, indications for use, this is where you're going to find it. For the treatment of bacteremia, empyemia, meningococcal bacteremia. Now remember, though, when you're actually doing the medication classifications, you're looking at the classifications of penicillin overall. Right now, I'm only looking at one drug underneath that classification. And if you remember, I gave you 3, but you only need to give me 1 indication for use. So find a common indication for use among all 3 of those medications and just give me 1. I don't need you to list bacteremia, empyemia, and then look at the other 2 drugs and find more indications. I just need 1. If you feel that you want to add more than one on there under the indications for use for your benefit, that's completely fine. Again, I'm just looking for one common one. If you have questions on that, let me know. So this is where you're going to find the indications. Again, I don't need to know anything about the dosage. So skip the dosage. You're just using this section to find the indications. I'm trying to think where I found, there was another section for side effects that must not be in here. So let's go back up. I'm going to close this section, but I mean, there's lots of dosages. Close that section here. Drug interactions. You might find some information in here, but mostly this is drug to drug interaction. However, there might be some good like patient education in here based on the medications. Like sometimes there are food related interactions. Like there's some medications you can't take with grapefruit, or you have to stop your vitamins while you're taking the medication, and there are certain antibiotics. So you might find some patient education within the drug interactions. So you could use this section. You don't need to know how it's applied. You don't need to do anything with the maximum dosage, but you do need to go under the mechanism of action. This is where you're going to find that the section about the desired effects. And so right here, you can see it's mainly a bactericidal action. And a bactericidal means it's going to kill the bacteria. That's the desired effect, to kill the bacteria that's related to the infection. You don't have to put it in depth. Make it simple. Remember, this is the information that I want to give to my patient. So put it into verbiage that you or your patient can understand. I mean, if you do put bactericidal in action, I'm not going to mark it as incorrect because it is correct, but I just want you to put it in a format that you could potentially understand. So again, this is where you find that desired effect. On top of here, let's talk about pharmacokinetics. Nope, that would be it. It must have been the other one that I did the side effects. So going back in here, classes, there's your class. You don't have to worry about administration, but if you want to, you can read about administration. Adverse reactions, this is where you're going to find the actual adverse reactions, the severe, and then the mild, which is going to be your side effects. Common brand names, this is where you're going to find the brand name because I've given you the generic name. You don't need DEA classification. You can look at description if you want, but the indication, this is where you're going to find the indications for use. And then the mechanism of action is going to be the same as the desired effects. So this is where you're going to find that. And then if you wanted to look at any of the other stuff, it's really up to you. So this is how you use PDR.net to find the information that you need. Let's go to the next one, RX list, which is another great one. So the same concept is that you're going to do the search and you're going to type in the medication that you want, the generic one that I gave you. And again, it's going to come up with all different types of medications. So let's go to the same one, click off of here, the same one that we looked at on PDR.net. And the reason I do both of these is because RX list is actually more consumer friendly than PDR.net. PDR.net has a lot of medical terms that may be difficult to understand for the layperson. So this one here might be easier to understand, but either one, or again, you could use both. So again, we've got our Pfizer pen. Here's, it says, shows you right here, here's your generic name. Here's your brand name. And for me, honestly, you don't have to add the G potassium. If I give you penicillin, you just simply write penicillin. That's completely fine. Look, there's your drug classification right there. Here's a little bit of a what is it? It's an antibiotic. Look, used to treat severe infections. There, right there, that's your indications for use. Severe infections, including strep and staph. We actually saw some of those on the other website. Take a look. Here's your side effects right there, listed side effects. And as you look at here, you can see these side effects were the same as those mild reactions on the other website, but it's listed here as side effects. But then you go to the serious side effects. And in here, the serious side effects, these would be the ones that you would click, that would be your adverse reactions. So on here, this is the differentiation of just side effects and then adverse reactions. But then if you go down here, seek medical attention. If you have serious side effects, you can take a look at these, and those would also be considered your adverse reactions. Remember, you need just 3 side effects and just 2 adverse reactions for the entire classification, not for each drug. So under the penicillin antibiotics, like I said, you have 3 drugs, but you only need 3 side effects for the entire assignment. Okay, you don't need to know the dosage. You don't need to know the drug interactions. There might be some additional information on here if you want to, but if you scroll down, here's a little description, which you don't need to. You can keep scrolling down. Uses, this right here, gives you a more in-depth look at what it's used for. There was just a little synopsis, a little summary up top, but you've got more down here, gives you lots of things. You don't have to worry about the dosages, but if you keep going down, here we go. Here's our side effects again. Another section for it. Warnings. Sometimes you might find some patient education under the warnings or even the precautions. So you could take a look at that and see if you find something for your patient education, if you can't find something else. So let's see, let's take a look at the warnings. Serious and occasional fatal hypersensitivity reactions. So let's say you have an allergic reaction to amoxicillin. If you have an allergic reaction to amoxicillin, you're more likely to become allergic to penicillin because it's in the same classification. So that could be a piece of patient education because it's directly related to this classification. Let's see. I think that's it that you would use for this website, but you can look at anything. Remember, these medication classification assignments are not meant for you to add everything in here. It's just for you to add a little snippet of that medication classification that's easy for you to remember. So that way you know, okay, what the medication classification is, what the medications in that classification are, the brand name and the generic name of those medications, what it's used for, what the desired effect is in the body, some common side effects, some common adverse reactions, a couple pieces of patient education that you would provide to your patient, again, in their verbiage, and then I just need to know where you found your information. So again, there's other resources you can use. I know MayoClinic.org is a really great one because the information in MayoClinic.org is very easy to find, very easily readable, but there's Hippocrates, which is great, your textbook, your for both classes. And if you find another credible source that isn't listed on there, that you found it was very user-friendly and it was organized, please don't hesitate to provide that to me so I can add it in the list of resources for future cohorts. If you have questions on what it is that you're looking for or how to find information, or let's say you type in a medication and you just can't find what I'm asking, please, please, please reach out. All right, that's it for this video.